morning to all. So I'm Dr. Vykunta Raju, Professor of Pediatric Neurology at Indira Gandhi Institute of Child Health. So today I'll be talking on spinal muscular atrophy. Spinal muscular atrophy, commonly called SMA, it is one of the commonest genetic condition, even though it is a rare disorder. So today I'll be discussing some few points about how they present, what is the current methods of treatment available in India. So it is basically genetic disorder, means it is inherited from both the parents, and approximately about 1 in 10,000 children will be affected with these disorders. So it can affect from newborn period to older age group like 70-80 years also, but commonly you will see in the children around 1 year of age. So based on age of onset, you are dividing subtype like 3 types. Those who are present in the early part of the life, like first year of life, usually called 1. Usually they will never sit, usually some amount of weight control will be there. Second type is the sitters, that is type 2, they can able to sit but they are never able to walk. Type 3 is the one they are able to walk but with little difficulties. So based on these clinical features, you will label the 3 types. And usually the commonest type 2, they will present to neurologist. Type 1 is, even though it is common, most of the children they will not survive because of treatment earlier days was not available. Most of the time they will die in 1 or 2 years of life because of infection and feeding problem. And type 2 is the most common currently. Prevalence wise is more common because they will survive longer time. And type 3, usually the diagnosis is difficult because that can be mistaken for many other neurological disorders and maybe misdiagnosed many disorders like cerebral palsy, other neuromuscular problem, and labeled as a non-treatable condition and diagnosed a little difficult. So basically the genetic condition means it is common in some parts of the India, especially come to South India is common because the marriages happens in the relatives. So it is more common in this part of the world. So it can be detected from newborn period. Some countries have newborn screening where they can detect this disease at the time of birth by screening with DNA blood test. But that facility is currently not available and not approved also because of ethical issues. But once a doctor suspects, they can refer to neurologists. So neurologists will examine some of the features that tells it is an spinal muscular atrophy. So after suspecting this disorder, so neurologists will suggest some of the tests that can confirm the diagnosis. Clinically, they will present difficulty in neck control or sitting. The motor function will be affected. Otherwise, cognitive understanding capacity, they will be very bright and they will be able to communicate. But only the sitting, walking problem will be the major features. And after this examination, usually doctors suggest some of the tests, some basic tests. After that, confirm the genetic test. There is a simple blood test. So usually result takes 1 or 2 weeks. And after that, usually the diagnosis will be made. So once a diagnosis is made, so there are a lot of issues with the parents. So currently there is a specific treatment that is to cure the disease, but before that there are many other supportive care is required for the child. So usually diagnosis happens a little late in Indian country compared to other countries because of awareness is very less. So by that time child comes to neurologist, there will be a lot of problem with the child. Like the child should have been developed already the weakness, deformities, dislocations, spine scoliosis, all those problems. So for that usually they requires care by multiple doctors, like physiotherapists, they require regular physiotherapy measures, and sometimes the bone problem should have been already occurred like dislocations, scoliosis, they require orthopedic care, and there will be a lot of problems with feeding also, so they require gastroenterologist help for improving the feeding issues, and they will be having a recurrent infection, that is one of the commonest cause for death in these children. So requires respiratory assistance like breathing devices to improve the function of the lungs. So comes to neurology basically they require rehabilitation, physiotherapy, occupational therapy, splint, all those things. Along with currently there are many medicines available to treat exactly this disease. Mainly there are 3 medicines are approved currently. So initially approved is Spinraza, that is approved almost 7-8 years back. So that medicine available, but currently it is not really available in India. Only one drug is available, that is Dipam. That is medication can be taken through the mouth. Coming to first drug that is approved is Spinraza. This is more old medicine, but a lot of data is there regarding the efficacy. Some of the advantages and disadvantages are. So disadvantage because it should be given through the spinal cord. So intrathecal method, what you will call. So child need to be admitted 1 or 2 days, and it is an invasive procedure pressure, there will be a lot of pain will be there. If already spine there is a problem like scoliosis, they cannot use this drug, and it is availability also issues, and they should be taken regularly for lifelong. Initially once in a week, later they require once in 4 months regular medication for lifelong. The other drug available is gene therapy, where gene therapy is one drug where they can use once only the drug, that is through the simple vein they can administer one time only, but the drug is very expensive. Currently in Indian rupees it costs around 15 to 16 crores. That is, most of the patients are not affordable currently. So this is one of the advantages. It can be administered only single day, but you need to monitor these children. They require again the rehabilitation care, and some complication can happen initially, so they should be monitored under the supervision of neurologists. The third drug that is commonly and approved and easily available in India is risdiplam, that can be administered to the mouth, and it should be given again daily, and it should be in a lifelong treatment. Again it will be costly, so based on child's weight the cost varies from 30 to 50 lakhs per year. So this only advantage is this is available and approved by government of India, and anybody can prescribe this medicine, and parents can be easily taken and it can be administered. So currently as this is also very costly, most of our parents 90% of them may not be affordable, but currently there are some schemes like they're coming from ESI, or they're coming from CGHS, or some other schemes are available, so they can get this drug. And the advantages is no need of any injection, no need of any admissions, and availability also good, and the only disadvantage is little costlier, and it should be given lifelong. This is specific medicine currently available for spinal muscular atrophy. So parents should not think that once they administer this drug they should be free and they don't need to go to any physiotherapies, all those things. Even though there are these medicines are taking, the parents should be continue the rehabilitation methods, like child already has a problem sitting, walking, they should continue physiotherapy along with other multidisciplinary care that these children require regularly, so that they should not develop any other complications. So if they start early, detection is early, the complication and multidisciplinary care will be less. But once the diagnosis is late and they start very late, already child should have developed all this problem, they require again long-term care by many specialists and regular screening for complications like hip dislocation and spine problem and pulmonary problems. So once if you start this medicine, and this medicine should be taken regularly under the supervision of neurologists, like once in at least 3 to 4 months they should consult doctor, and doctor will monitor the side effects of medicine and also any complication of this disease they are getting. So they should follow regularly doctor's advice, and usually the prognosis is good once if we start this medicine very early, and they can lead almost nearly normal life. So they're coming to the prevention in the next baby. So once the diagnosis is made, even though that some of the parents may not be affordable, at least they should prevent recurrence in the next baby. So whenever they're having next baby, planning for next baby, they should go for genetic testing, and so they can detect very early, so they can avoid the next baby with a similar complaint. So they should consult doctor before planning for next child. Thank you.